The heater is hot. Okay, so I have checked my provider's orders and we have an order for an NG insertion. I have identified my patient. I have explained the procedure to her, noted any questions that she may have about it. So I'm going to start by doing a focused GI assessment, listening to her bowel sounds, noting any distension, nausea, vomiting that she may have, any pain, palpate, trying to see the reason why the provider has actually ordered this for her. Now I'm going to apply the drape so she doesn't get anything on her clothes, provide her with an emesis basin, a water glass for the second half of the insertion, and a tissue. And now I'm going to open up my package, put my tubing, and hand hygiene. I'm going to apply my gloves. And we're going to start by measuring the length of the tube, checking for a guesstimate of about how far down we're going to need to go, so we don't go too long or not long enough. So I'm going to start. I have my tube clamped already, and I'm going to measure from the earlobe to the nose, and then down to the xiphoid process. And I'm going to hold on to that and mark it with a piece of tape. And I'm going to place the tubing in ice, and it's going to help to harden it so it makes it easier when we insert it. And I have my lubricant on this little piece right here for when we start. So now that my tubing's hard, going to lubricate it about 4 inches on the tube. Have my patient tilt her head up. I'm going to inspect her nares, see which one has the greatest airflow, because that's going to be the easiest one for us to go down. So we're going to go into her right one. To start, we're going to have her tilt her head all the way back. I'm going to start inserting into the nasopharynx. Once we get there, I'm going to pause, hold on to my tubing, have her tilt her head down, and I'm going to instruct her to drink until we get to our marker. Ready? Drink, 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 drink. And holding on to our tubing, grab another piece of tape, and I'm going to secure it. Make sure it's secured well. And with the other part of our tubing, we're going to tape her down, making sure she still has room to move her head. And now I'm going to take my piston. I'm going to take out a little bit of the stomach acid to test the pH to see, did we make it in the right spot or did we not go far enough. I'm going to take a little bit out, reclamp my tubing, place it on a pH strip. It should read less than 4. If it's greater than 6, then we know that we definitely are not in the right spot and we need to take it out and redo it. Also, I'm going to send my patient down for an x-ray to make sure that it is in the right spot. Also, if my patient is experiencing any gagging or coughing, I can check in her mouth with a pen light and tongue blade to see if there's any coiling in the throat. If there was, I would take out the tube, give her a little time, relubricate it, and insert it again. Also, I'm going to take about 5 cc's of air and I'm going to insert it. And this is just going to help push the tube off the lining of the stomach. So it's not, occluded from any suctioning. And once we have it confirmed by the x-ray, I'm going to go ahead and hook it up to low intermittent suction. And afterwards, go ahead and clean up. And I'm going to assess my patient again, making sure, it's working properly, noting anything from her if she's feeling better, nausea, vomiting, relieved. I'm going to do another focused GI assessment. Palpate, all that, and continue to monitor my patient every 4 hours. And now it's been some time and the doctor has, checked her out. Everything is, getting better, back to where we want it, so we can go ahead and take the NG tube out. So I verified my patient, verified the doctor's orders. I'm going to go ahead and give her her drape. And she also has a tissue here for after the procedure. Gonna go ahead and hand hygiene. And we're going to do another focused assessment, making sure that we are able to, take that tube out, because we don't want to have her go through this again when we can just leave it in. Place her drape back. Everything's sounding good. Now, hygiene. Apply my gloves. Okay, with my piston, I'm going to draw up 20 mils of water, and then 20 mils of air. And we're going to insert this down the tube. It's going to help to clear out that line. So when we pull it up, she doesn't get any, or it's going to help so she doesn't get any heartburn or experience anything like that. We just want to help alleviate that for her. Reclamp my tubing, take it off of suction, all that. Now we're ready to take out her tube. I'm going to start by taking her tape off. And I'm going to instruct her on the count of 3 to take a deep breath in and hold it while I pull it out in a fast motion. Ready, 1, 2, 3, deep breath. Pull, 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 and out onto the chuck. Fold that up. Discard it. Gloves off. Hand hygiene again. And we're going to do another focus assessment, make sure there wasn't any complications. Listen to that. I'm going to document it. I'm going to note the time that it took it out, how the patient responded to it, all that. And when I was putting it in, I would document, the drainage, the amount, the color, the size of the tube I put in, what time I put it in, all that. After we took it out, I'm going to come back in another roughly 10 minutes to recheck her and make sure she's still doing well and there wasn't